Let's move to health. And Ghana has recorded a significant drop in active COVID cases between February and April 2021. That's from over 8,000 to less than 1,500 cases. Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, is attributing the significant reduction to the vaccination exercise. According to him, the number of Ghanaians taking the safety protocols seriously went up to 52% when the vaccination started.
When you get to the Kotoka International Airport, which is a very major area of preventing importation of cases, we have so far tested about 1,400. We have recorded 1,435 cases since we started on the 1st of September last year. Majority of them are non-Ghanaian citizens. Males outnumber 63% of that. We've done 233,000 tests on arrival since we started, with a cumulative positivity of 0.61%, and so it's not as high as the local community ones. But as you can see in the next slide, since January last year, our numbers that is being required at the airport has significantly reduced, averaging around 90s for every month. Around the Easter, we had a few issues. But that is not to say that we are out of the woods. We still have significant threats, especially with the third waves in Europe, the rising cases in India, Brazil, among others. These are also poses a threat to our cases, so we need to work very hard to prevent them, and that is why the work at the airport remains very, very significant, especially with the advent of new variants, which we may not know how the Ghanaian population will handle that. So the positivity rate at the airport has significantly reduced, but there's a slight rise, and I think that's all because of that. We have received a total of 966,850 vaccines, 600,000 from the COVAX facility, 50,000 from as a donation from the Indian government. We have 165,000 from MTN Africa, and then 149,000 as a second dose also from MTN Africa, bringing the total about 315,000 from the MTN group. Based on some of the WHO recommendations how to deploy AstraZeneca, the recommendation is that it has to be the dosage of between 8 to 12 weeks interval doses. That is, as far as vaccination is concerned, what we have most important is the minimum time within which a second shot or booster dose can be given. If you do it before that minimum date, you will not get any benefit. But sometimes the longer you wait, it still doesn't matter that you can still have your second shot and get your booster dose build up. The WHO has done a lot of studies and has also shown that, number one, is that if you give it before 4 weeks or before 2 weeks, there's virtually no benefit. But between 8 and 12 weeks is the best time to give. Even then, you would have lost some percentage of your antibodies. It's still effective enough to protect you. What is the efficacy of one dose? According to the studies that have been done globally and around, it protects you about 76% protection for over 90 days, which coincide with the 12 weeks we are talking about. But that's not to say second dose is not important. And so, given the vaccine availability, that is why we are now trying to shift it to the 12 weeks. But as vaccines are made available, like I said, the earliest is the 8 weeks, and that you'll be giving your vaccination. There are significant efforts being made, and we have some assurance from COVAX that by May we'll get vaccination, and if we get our vaccine in May, we'll be able to do our second doses and as a service, you are more concerned with having more people with the first dose. Well, that's what can also cause the distance. But we've got enough, and there are also bilateral arrangements that are bringing in other COVAX vaccines, including Johnson & Johnson, which we are expecting probably in the third or fourth quarter of the year. And then a lot of work is going on to get vaccine Sputnik for everybody. So we are showing people that The fact that if you don't get it on the 8th week, that doesn't mean there's something wrong. We still have a 4-week window and beyond to have it, and we are expecting more vaccines to come in to provide the protection that we all need.